Hello and welcome back to the Polaris Travel Health Podcast. Thank you for tuning in with us this week. I'm Jason Komet, and this week Jayden and I will be discussing some of the ins and outs of traveling to a resort.
Yeah, I think a lot of people see resort travel kind of as a simpler or easier way to have a relaxing vacation with their family or with their friends. But people also tend to think of it as a very safe type of vacation. And we wanted to cover a few things that everyone should keep in mind. So, kind of as an overview, what are some of the major things that travelers should be aware of or looking out for when traveling to a resort?
Okay, well, I think what you're saying, Jayden, actually is true in the sense that the last thing that these resorts it's bad for business if people get sick.
Right.
So they want to make sure that they do what they can. But that being said, there still is some risk associated. Anyone who's traveled to these kind of resort locations know that sometimes stuff can potentially go wrong health-wise. So whenever we do any kind of travel appointment, we always want to look at three main topics of conversation. Always, we want to talk about vaccines. We want to talk about diarrhea risk, and also about bug risk and mosquito risk, that sort of thing. Right now, we'd also want to be thinking about COVID rules, but I think for the purposes of today, we'll just leave that alone because it's been changing so much. And the other three main core elements, they're a bit more consistent at this point.
Right. So, kind of going from the beginning of when you would be sort of looking into having a trip, in terms of travel health, how might someone spot a resort that could kind of put them at risk for something like traveler's diarrhea or other types of diseases?
I think it's really hard to do that by, looking at a website or even in discussions with travel agents and stuff. There's no real obvious thing that you can look for. I think I'd be more inclined to be thinking about destinations. There are some locations that, there could be a risk of a dengue outbreak or security concerns. And we know in Punta Cana, Dominican Republic, there can sometimes be malaria risk. So
Right.
that wouldn't be specific to a resort, but more specific to a location.
Right. What about something that you would notice upon your arrival that could be considered a red flag for your health?
I think, obvious quality control issues where, food's been sitting out at extended periods of time, lack of cleanliness, lack of hand washing, these kinds of things. I think that those situations are relatively few and far between, but sort of common sense precautions would prevail, I would think.
Right. And so if you were to be caught in an unfortunate situation where you saw something like that and you did get sick, what should you do to kind of get in touch with some medical care while you're abroad, kind of staying at a resort?
I think the best thing to do would be get a hold of the staff and the concierge, that sort of thing. And very often these things happen, right? So they have connections in with medical clinics and stuff. And as I mentioned before, they don't want anything really reflecting poorly on them. So they usually will do what they can to try to make things smooth and help with getting you assistance quite rapidly.
Right. Yeah. They probably don't want you to give them a bad Expedia review or something like that.
Exactly.
So you guys do a resort travel health consultation, like a specific one for traveling to a resort. And we touched on this a bit in one of our previous episodes, but what types of things do you generally discuss in terms of risk factors, specific vaccines, and medications?
I think probably the two most likely things and most important things we touch on in a resort consult is traveler's diarrhea, and also looking at hepatitis twin risk vaccinations. I think are probably the other thing. Now there can be other things depending on specific activities, specific locations, but those are kind of the two big go-to topics.
Sure. What is traveler's diarrhea? Like, if giving like a specific definition.
Okay, so when I think about traveler's diarrhea, and as far as how you would define it, it would be 2 to 3 bad episodes of diarrhea the same day with other symptoms like cramping, fever, chills, that sort of thing. And also your planned activities have gone astray. You don't want to leave the room, you really feel lousy. So we usually look at all of those things. Over the years, there's been varying different ways to try to define when have I really crossed the line into traveler's diarrhea.
Right.
But I think all three of those things really should be in place before you really make that pronouncement. And when you think about traveler's diarrhea, it is, realistically speaking, the most likely thing that's going to happen to you on a trip like this. As far as causes and that sort of thing, we'd be looking at bacteria most commonly, probably in the 80% range, virus maybe in the 15% range, and then other things, other pathogens would be around 5%. The E. coli bacteria is the most common bacterial infection that causes traveler's diarrhea. That's the one we'll talk about Ducrol, I think, in a few minutes. That will go explain that a bit. But those are some of the things that the basic notes on what for traveler's diarrhea.
Right. So if you do end up getting traveler's diarrhea, because it is quite common, what should you do? What are your options kind of for treatment?
First thing you should do always is hydrate. Got to hydrate like crazy. You got to remember that you're already in a hot place where you're probably losing fluids. Chances are maybe there's some alcohol involved as well, which is not exactly helping your hydration situation either. So there's a lot of things already conspiring against you that maybe make you a little bit more dehydrated than you usually will be. And then even one bout of diarrhea you can lose a lot of fluids. And of course, in smaller children, one episode of diarrhea can really, from a body size perspective, can really throw a wrench into things. So you really got to be careful on the hydration. I think that would be the first thing I'd be looking at. Right. Then you got to start thinking about, is it one random diarrhea? And we can't really ascribe a pattern to it yet. It's just, it was an unfortunate bathroom incident, but that's kind of as far as it goes. I would just monitor at that point. You can always take symptomatic treatment, something like an Imodium, which can control diarrhea symptoms. But generally speaking, I would just monitor and hydrate and kind of go from there. But if you start falling into that definition we described earlier, where you have a few bad episodes, your guts feel like they're going to explode, you don't want to do anything. At that point, I think, most people are able to make that self-diagnosis that, okay, this is a pattern, something's wrong, my trip's getting messed up, I've got traveler's diarrhea. So after the point you have your self-diagnosis, we know that most of these infections are bacterial. So what we would typically do is we would prescribe an antibiotic that you would take with you from Canada and have it in your bag with all of your other assorted medications and other things in your little makeup bag, shaving bag, whatever. And you'd have these available. And if you got to that point, you'd start taking them. And usually we do a 3-day supply of the antibiotics. Most of the time, symptoms are completely resolved in 24 to 48 hours. Right. There are liquid versions for kids, so they don't have to worry about swallowing pills, and also that we can dose it based on their weight, because in smaller children, you don't get the same dose as an adult. I think it's always important to mention too, though, that these antibiotics are kind of your nuclear option, right? Like, we don't want people just randomly taking antibiotics. We want sort of responsible use of antibiotics. So I think that you want to make sure that you are really legit sick. I don't ever want to hear stories about somebody who said that, the first day after they got there, they had a little bit of a stomach ache, so they just decided maybe they should just take their antibiotics. Like, no, it doesn't work that way, or shouldn't work that way. So, you want to get to the point where it's severe enough that you want to pull the trigger. And I think the last point I would probably want to throw in there is, if you don't feel better in 3 days, after all 3 days of the antibiotics, something else weird is going on, because any kind of typical bacterial traveler's diarrhea will be killed within those 3 days. And then the other thing is too, we talked about viral traveler's diarrhea being about 15%. The antibiotics won't help against viral traveler's diarrhea, but viral traveler's diarrhea goes away in about 48 hours all by itself. So you'll actually think the antibiotics worked, but they didn't.
Right.
But you're better, so in the end, it's good, right?
Exactly. So you mentioned Imodium. That's kind of like an over-the-counter type of medication, right? Like, you can get that kind of just at a drugstore.
Exactly. So Imodium is a great quick fix. Really, what it's doing when you take an Imodium is it just plugs you up. And sometimes that's what you need if you really are having the diarrhea is really severe and you just need it to stop. So I think that it is the ideal quick fix thing to use, but it doesn't go to the heart of the problem. So if you are having traveler's diarrhea and it's likely a bacterial infection, it's not going to help from that point of view. It'll help that you won't be spending the whole time in the bathroom, but it won't actually get to the true root of the problem.
Sure. So, in terms of like preventing traveler's diarrhea rather than treating it once you have it, what kind of are the options for that? We mentioned Dukoral, but what's the deal with that?
Okay, well, Dukoral is essentially it's an oral vaccine for your gut, which actually does protect you against certain types of bacteria that cause traveler's diarrhea. I mentioned before that E-tech, E. coli bacteria is the number one cause of traveler's diarrhea. Dukoral essentially will help vaccinate you against that bacteria. So it's something you mix up and you drink 2 weeks in a week before you go away on the trip. It's all done well before you go. And then if you get exposed to the E-tech bacteria, you essentially won't get sick. You won't get traveler's diarrhea. But that being said, if it's another type of bacteria, it's not going to help against that. So it is not foolproof by any stretch
Right.
of the imagination. So I kind of look at Dukoral point of view of it's not the most effective, super beneficial thing in the world. But then again, not a lot bad happens with Dukoral. The downsides are pretty limited. You mix it up and drink it. It doesn't taste great. That's what lots of people say anyway. And it can give you a little bit of gassiness after you drink it, that sort of thing. But generally speaking, it doesn't absorb into your bloodstream. It just basically does its work in your gut and then goes out. So there's not a lot of drug interactions or other concerns about any kind of systemic body-wide side effects. They're mostly just gut-related side effects, which are really mild. So the downsides of taking it are very limited. So like I said, the benefit, it's not a rock solid guarantee you're not going to get sick, but like I said, not a lot going on a negative side. So I guess whenever I think about Dukoral, how bad do you want to cover your bases? And like, are you willing to pay for it is what it really amounts to. It's not a cheap vaccine. You're looking at about $100 for the double dose of it, the initial dose. And so some drug plans pay for it, that sort of thing. But that's the general thought process. I even like to break it down sometimes when I have people in and they're talking about Dukoral. Like, I want to look at really 4 factors. Have you ever had trouble with your guts before? Like, do you already have pre-existing gut conditions? That would make me a little bit more inclined to want to do Dukoral.
Right.
Also, just the activities you're doing, like how risky is your eating going to be? Are you staying on the resort? Are you planning on going off resort? Are you planning on eating really weird things off resort? That would be a consideration as well. And like I said, how bad do you want to cover your bases? I still remember this story. This is several years ago, but I think it's probably worth mentioning again because it's just such a classic example. I had a person in for an appointment and they were doing a typical Mexico resort trip. And I asked them, why are they going on this trip? And they said, going for a destination wedding. And anyway, we got to the Dukoral part and I explained it to her sort of in the similar terms. And I said, it probably cuts your risk down maybe by about 1/3 potentially. And anyway, she said to me, I'll take that. I'm getting that right away. I said, okay, we can do it. She goes, I don't think I mentioned to you, I'm the bride. So like, even if I get a 30% less chance of getting diarrhea that week, I am all in.
That's great.
I was like, yeah, you're spending thousands of dollars on this wedding and everything like that. I could understand just wanting to mitigate the risk a little bit. And then the 4th factor, like I already mentioned, was about payment and that sort of thing. I look at it sometimes if you've got a family of 4 going to a resort and you don't have a drug plan, it might be a little hard to justify, doling out $400 for Dukoral.
Right.
But everybody's different. I think we always like to try to work with our patients, in regards to what is the best option for them and trying to keep finances in the picture and keep what's the best way of preventing of risk mitigation. But I think for a product like this, you always want to think a little bit about cost benefit.
Definitely. Another thing I wanted to touch on with the Dukoral is that it also protects you from cholera. How often would you say that that's like a concern or a driving factor behind prescribing it to somebody?
I'll tell you right now, Jayden, I could probably count on fingers, maybe a little bit more than that, the number of times I've prescribed Dukoral for cholera. So if you want to go back into the past, Dukoral was originally invented as a cholera vaccine. And it's actually really quite effective at preventing cholera. Cholera is a bacterial infection, and you mix up do crawl and drink it, and it probably decreases your chance of getting cholera in the 70-ish% range. It's a much higher percent of effectiveness than it is against traveler's diarrhea. But
Right.
the reality is most people going on resort trips, other trips, are not going to get exposed to cholera. Cholera is a bacteria that is in contaminated water. And if you're drinking bottled water, any source of good water source, you're not drinking from some contaminated well or something like that, it's not likely you're ever going to run into cholera. The only time we ever really see prescribing it for cholera is when you have aid workers that are going. I remember the earthquake in Haiti a bunch of years ago.
Right.
I saw people going there, and we were giving them Ducurl for cholera because they didn't really know what they were going to be running into in regards to water sources. So that was a time where I can remember prescribing it for cholera, but typically speaking, not often.
Right. Yeah, you're more likely to run into the ETEC than you are to the cholera bacteria.
Absolutely. If you're
Right.
running into cholera at a resort, there's big problems.
Yeah, that's definitely a big problem. So kind of on another note, another concern I think a lot of people have going to resort is about hepatitis, namely A and B. So how would you go about catching hepatitis, either one of them, and what would the symptoms be?
Okay, so hepatitis, I think one thing that's always good to sort of recap to start with is these hepatitises A and B and C and D and E for that matter. There's actually 5 of them that we theoretically could talk about.
Right.
They're all viral infections. They all attack the liver, but you get them in very different ways. Even though they sound very similar, how you actually get is really drastically different. For the
Right.
purposes of right now, let's stick with the A and the B because that's what we can vaccinate against, and that's what usually comes up. So hepatitis A is spread through contaminated food and water. So how you would typically get this is somebody, well, here's the resort example. So you've got some guy who's working in the kitchen in the resort. He goes and uses the bathroom. He may not have washed his hands after he went to the bathroom. And then he comes back to the kitchen and starts prepping up your food. That
Right.
could be a risk of how you would get hepatitis A. So it's a very incidental thing. You can't go in and look in the kitchen and figure out, oh, that guy looks like he's got hepatitis A. In fact, most people have no symptoms for several weeks. Someone could look fine, but meanwhile, they could be passing on hepatitis A when they're
Right.
handling food. And in tropical countries, hepatitis A is sort of a background disease that is not maybe present all the time everywhere, but it's just in the mix, in the background, in the mix. We don't really have that here. The only time in Canada we tend to see hepatitis A infections are when they've been imported in from another country, and then there's the potential for spread once it's brought into the country. But for
Right.
example, your Mexicos, your Jamaicas, Cubas, hepatitis A is just something which is just present. So that's what you're talking about for hepatitis A. Hepatitis B, you get this through bodily fluids. So you're talking about sharing needles, sexual contact, any kind of touching or body fluids, that sort of thing. So the other thing which I think is relevant, which I know I've done this for people, hepatitis B, if you're going to get medical care done in a resort type setup, if you're going to get some plastic surgery in Mexico, which I've done
Right.
those appointments, hepatitis B is probably a good idea. So
Yes.
when you look at hepatitis B, it is something that is more the incidental contact that you get from, like, hepatitis A could be completely an unknown random thing. Hepatitis B, you probably would be more likely to know if you were being exposed to it by just some of the activities or some of the things that would happen. Either way, you don't want either of these illnesses.
Right.
If you start thinking about hepatitis A, inflammation of the liver, fatigue, flu-like symptoms, jaundice, you really can feel really lousy. As far as hepatitis B, similar in the sense you get fatigue, tired. But the thing is with hepatitis B, which is really scary, is that it can develop into a chronic illness, which can really wreck your liver. So
Right.
both of these things, you don't want either one.
Yeah.
And the nice thing is we have vaccines against both of these that are well established, highly effective. So we definitely have options from the standpoint about what we can do to prevent hepatitis A and B.
Right. I think a lot of people are curious about the hepatitis A and B, the Twinrix vaccine with the combined one, because there's a lot of advertising for it in reference to resort travel. But what situations, like how often would you say you generally prescribe it?
Very often. So I think those Twinrix ads, it's good marketing. It's great marketing.
Yes.
But I think the thing that you need to remember here is we need to evaluate whether you really need the Twinrix, like an A and a B, or you just need an A. That is kind of something that needs to be considered. So I'll give you an example right now. Hepatitis A is never given as part of the kid shots in school. If you get
Right.
all your vaccines in school, no matter whether you're older or you're currently in school, hepatitis A is just not done. Hepatitis B is done as part of the routine school shots, usually in grade 5, 6. Actually, they're
Right.
bringing that down now, so it's going to be part of the baby shots. But essentially, if you were born after 1982, unless you didn't get some of your vaccines in school, if you're from that age forward, you probably got hepatitis B vaccines as part of your school vaccines. That would be something you'd always want to look at. So if you are basically in that 40 plus age group, pretty much, you wouldn't have got hepatitis B as part of your kid shots. But if you're like 25 years old and you got your shots done in school, you probably already have your Bs. So Twinrix is maybe not needed. Maybe you just need to get the A done.
Right. So a lot of people who maybe are above that kind of like 30-year mark might be concerned about Twinrix because it takes 3 doses and not everyone is necessarily booking a resort trip that would be that far ahead of time. Is it necessary to get all the doses before you go, or can they be accelerated, or are you kind of protected maybe before you get the last one?
So with Twinrix, the normal schedule is 3 doses. You get one done today, another one done in a month, and then another one 6 months later. And then that's basically it. You're good for 20 plus years. So
Right.
one dose of Twinrix by itself does not provide you with full protection against A or B. So you really need the 2 doses and the month apart. So lots of times we'll hear people talk and they'll say, oh, I don't have time. It's too late for me to come in for an appointment because I'm leaving in 2 weeks or something to that effect. So there are a couple options available. One option is there is an accelerated schedule for Twinrix where you basically take 4 doses total. You get one
Right.
dose today, another dose in a week, a third dose 21 days after your first one, and then a 4th dose in a year. Now, that's an option, but it's actually not the most awesome option because you need to basically get all 3 of those doses in the 21 days before you go. So
Right.
instead of having to spread out a month apart, you've got 21 days. So it helps, it's helpful, but you still have that window of time of what if I'm leaving in a week or 2? One dose of Twinrix isn't going to cut it. So what we'll do lots of times in those situations is whether you have your hepatitis Bs or not, like say for example, you're 50 years old, you never got your hepatitis Bs as part of your kid shots. What we'll do is we'll just give the vaccine separately, an A and a B separately. And the reason for this is if we give you one dose of hepatitis A by itself, there's enough vaccine, there's enough Hep A antigen in a single Hep A shot that you'll be protected on your trip.
Right.
But if we give you one shot of Twinrix, there isn't enough Hep A in there. So what we would do if you showed up and you're like, I'm going to Cuba in 7 days, what can I do? Well, what I would do is I'd give that A because we know we want to protect you against A, and one shot of A will cover you. Now, what I would also probably look at doing is suggesting that we give a dose of B separately so that you do have some level of protection and coverage on B. And then I would follow up with a second dose when you get back. Now, that being said, you're probably not going to have full protection against hepatitis B, but I would rather have you go in to the trip knowing that you're fully covered against A, which is the more likely one you're going to run into, and partial coverage with B, as opposed to say one Twinrix where you're kind of partially covered for both. I want you covered for the A more than anything else.
Right. So if you say are someone like me who would have gotten the hepatitis B vaccine as part of like the public vaccination campaign, Do you need a booster after a certain point? Like, if I was, say, to travel to Mexico in 10 years from now, would I need another hepatitis B shot before I go to make sure that I was, good and covered? Or is that one kind of more of like a for life type of thing?
Yeah, typically we wouldn't routinely recommend a Hep B booster for someone like yourself. If you got your doses when you were a kid, the only times I would really want to boost that up is or look at that as a possibility would be if you were involved in higher risk activities. Are you going to be doing healthcare? Like right now, when we have students coming in they're going into medical professions, we always want to make sure their hepatitis B is up to date. But if you don't have an occupational risk, and we know you got your doses, unless you're going down there for medical care, you're going down there, you're planning on getting a tattoo or doing something, that we would consider to be a high risk Hep B type thing, we ordinarily wouldn't. We would presume that your immunity is still good and leave it at that. That's probably where we would leave it at. So for someone like yourself, if you came in for an appointment and said, I think I need Twinrix, I'd be like, no, you don't need Twinrix. You just need a Hep A, which, is interesting because lots of times we do get people that are younger and they'll say, I need Twinrix, or essentially they're quite happy that they don't need Twinrix because instead of having to do 3 appointments, we just do, and 2 appointments before they leave, we just have to do the 1 appointment. They don't even have to come back before their trip. So less shots, cheaper price, hard to argue with that.
Very true. Very true. Okay. Well, on another note, speaking of different diseases, is there generally a risk for getting a mosquito-borne illness while you're at a resort? Should people who are planning a resort trip be worried about something like malaria or dengue or anything like that?
So when you think about countries like Mexico, Jamaica, Cuba, there's no malaria in any of those areas. The only place of the typical all-inclusive resort locations that Canadians go to that we sometimes can see malaria is Punta Cana, Dominican Republic. Now, there is some level of risk there. The risk is not incredibly significant, but there are situations where, depending on what's going on there with current outbreak status and other factors, just how badly we want to cover off bases, that sort of thing, we will sometimes prescribe antimalarials for that part of the world. So from a malaria standpoint, that's the place we have concerns about. Now, if you start going off the all-inclusive resort, then we start talking about areas in Central America and stuff. That can be different. But like really, Punta Cana is the only common resort area where that would be a concern. But really, dengue fever is more likely a risk. So we know dengue is a daytime mosquito, which likes it in more urban areas. They like living in more urban areas. So we know that these resorts take a lot of care in regards to mosquito control precautions. A lot of people will say, oh, geez, I was at the resort. I never saw any mosquitoes. Well, that's great. I'd like to think that being on the resort, your risk is probably lower. But we know these mosquitoes are in these areas, and there are cases of dengue. Dengue is not completely unheard of in returning travelers. So it would be something that would be a consideration, and we don't have a vaccine for dengue, so common sense precautions prevail. You just want to use bug spray and monitor accordingly. By the same token, something that came up a few years ago was Zika virus. And Zika virus was a big concern there because there was an outbreak in a lot of the resort type locations. The incidence has gone way down now, but there is still probably some level of risk, just like with dengue. Zika, realistically speaking, it's a viral infection that unless you're pregnant, it's usually not too severe in most people. But if you're pregnant, it can be really problematic. Right now, we are still thinking about that as a consideration when some people are going away on resort trips. Not as much of a concern as it was a few years ago, though.
Definitely. What about a different type of bug, like anything that would be venomous or other bugs that could kind of cause you problems that might be found in an area that has a warmer climate where you would be staying?
When I think of venomous things, I guess the first thing that I would think is like a jellyfish, which is not really a bug for sure, but jellyfish would be something to be potentially concerned about. When you're at a resort, you could potentially run into those when you're swimming in the ocean. But I think that your chances of running into like snakes or something like that would cause a problem would be very minimal. The other sort of strange thing, I guess, from an insect kind of perspective. And it's not really at all inclusive so much, but in Belize, you can sometimes run into something called cutaneous larva migrans. And Jayden, I think I already warned you, don't YouTube that.
Yeah,
It's
so gross.
It's very gross. It's not something that we typically would see in all-inclusive resort situations. We have seen it in Belize and some other locations in Central America, but you won't want to walk barefoot on a beach after you see some of those videos. But it's basically spread by dog feces, and where a dog basically poops on the beach, and that's how it can be. Cutaneous larva migrans can be in a beach, and yeah, don't Google it.
Yeah.
Bad
Well,
idea.
they get inside of your skin, don't they?
Yes, they do.
And then they lay the eggs. Oh,
Yep.
horrifying. Horrifying stuff.
Yes, I've known people that have gotten them, and it's not pleasant.
Yeah, yeah. Okay. Well, do you have any final thoughts? Anything else you'd like to mention about resort travel?
I think we've covered most of the important things. I think whenever you are planning more stuff off the resort, you have to sort of think about that a little bit more, about activities and eating. And I would always be a little bit more concerned about kids and diarrhea, just because they're so small and you want to be really careful about hydrating them. So those would be things I'd always want to think about. Also, pregnant or planning on becoming pregnant, as I mentioned before, Zika risk has really dropped, but it's still something that we want to at least contemplate. So there are some special, patient risk groups that we would want to think about a little bit. But, I think those are a couple things I would also want to contemplate.
For sure. All right. Well, one thing I did want to mention before we go today is that the advice that we give in this podcast is not a substitute for real tailored medical advice to your specific medical history and your specific itinerary. So please keep that in mind. But we wanted to thank you for tuning in to this week's edition of the Polaris Travel Health Podcast. Make sure that you're following us on Twitter at Polaris Travel RX, and that you check us out on Facebook too. And we hope that you'll tune in with us again next week.
Thanks, Jayden.
Yeah, thank you.